Hello, I'm Dr. Chettasak from WIH International Hospital. I'm a plastic and reconstructive surgeon with 30 years of experience in gender-affirming surgery. Gender-affirming surgery is a complex procedure because we have to transform male anatomy into female anatomy. There are three main goals of the surgery. Goal 1. The patient must have special sensation at the clitoris and the inner labia. Goal 2. The shape of the female genitals must look as realistic as possible. Goal 3. The vaginal canal must be functional and allow for sexual intercourse comfortably. To achieve all three goals, we must combine both cosmetic surgery and reconstructive surgery in the right balance to get the best possible result. I have my own surgical technique called Dr. Chet's NPI. NPI stands for Non-Penile Inversion. This means we do not use the penile skin to invert and line the vaginal canal. Instead, we use the penile skin to create only the inner labia and the vaginal opening. Apart from creating realistic external genitals, the NPI technique is also outstanding in preserving sexual sensation because I focus on preserving the main sensory nerve called the pudendal nerve very carefully. The parts of the genital area that are created with NPI technique and can give intimate sensation are Part 1. The clitoris and the skin that cover the clitoris, which is called the clitoral hood. Part 2. The inner labia, which are created from the pupil skin, the foreskin, a thin pink skin that is very sensitive to touch. For patients who were circumcised, there may be less pupil skin and it may not be pink, but I can still use the remaining skin to create inner labia that have sensation. Part 3. The area of prostate sensation, which lies close to the new vaginal canal and is located near the position of the G-spot in cisgender women. In gender-affirming surgery, the prostate gland is not removed because the urinary tube passes through the prostate. And the area also contains pudendal nerve and pelvic nerve, which can give deep sexual sensation during vaginal intercourse. The ability to preserve these sensitive areas and help patients achieve orgasm in nearly 100% of cases is a key highlight of the NPI technique, which allows my patients to experience complete feminine pleasure. Today, I want to talk about how I approach the surgical technique that get the most natural and beautiful results. Over the years, I found that the key to success lies in three important areas: creating the inner labia, shaping the vaginal opening, and refining the urethral openings. Let's start with the inner labia. This is such an important part of the overall result because it frames the vaginal opening and protects the urethral area. I use a technique where I craft the inner labia from a thin pinkish layer of skin called the pupils, which gives it a natural look. The position is equally important. It needs to be placed close to the urethral opening so it can cover and protect it. The labia should start just below the clitoris and extend all the way down to the vaginal opening, creating a smooth and natural flow. Next is the vaginal opening itself. For this, I shape it into a V-shaped design, which helps control the width and make it look beautifully natural. This shape gives the opening a soft and realistic appearance, just like a cisgender woman's anatomy. The third critical part is the urethral opening. This needs to be smooth and in the right position without any visible or protruding tissue. Sometimes leftover erectile tissue from the original anatomy isn't completely removed, and this can cause a small stump that might swell during arousal. To avoid this, I make sure all expandable tissue is carefully removed so the urethral area looks clean and natural. The technique I use for all of these is called Dr. Chet's Non-Penile Inversion technique, and is designed to tackle these 3 points perfectly. One of the challenges in surgery is that every patient's anatomy is different. Some have longer structures, while others have shorter ones. But I believe that with the right technique, it's possible to deliver consistently beautiful results that are as close to natural as possible. Thanks for listening. I hope this helped you understand what goes into achieving amazing outcomes in gender-affirming surgery. Every detail matters. And my goal is always to create results that patients feel confident and happy with. While consulting with patients before surgery, it's important to have detailed discussion to fully understand what they want and make sure all the details are clear. Besides explaining the surgical technique, I always summarize their priorities and expectations in order. Interestingly, over the past 20 years, the ranking have never changed. More than 90% of patients have the same top priorities. Appearance comes first. They want it to look as natural and realistic as possible. Spatial sensation is second. This is straightforward. Patients prioritize the ability to experience pleasurable sensations. Vaginal depth comes last. When we discuss vaginal depth, most patients say they're happy with 6 inches or about 15 centimeters. I ask, why do you want 6 inches? A woman's vaginal depth is around 4 inches. Some patients explain that they've researched and found that I can generally achieve at least 6 inches, so they expect that. Others mention their partner's anatomy and say, doctors, you've got to make it deep enough for my partner's size. Ultimately, I aim to create the best depth possible for every patient. If I can achieve more than 6 inches, like 6.5 or even 7 inches, I will, even it adds more time to the surgery. Patients to achieve this depth have a clear advantage over those with a depth of just 4 or 5 inches. In the previous episode, I explained that the standard depth for creating a new vagina in gender-affirming surgery should be no less than 6 inches or 15 centimeters. This depth is about 2 inches longer than a natural vagina, which is typically around 4 inches at rest and can expand to 4.5 to 5 inches when aroused. The main medical reasons for creating a deeper new vagina are as follows. First, elasticity is an important factor. Unlike a natural vagina, a surgically constructed new vagina using skin graft does not stretch as much. The deepest part of the new vagina cannot expand significantly when pressure is applied, such as during penetration or vaginal dilation. Essentially, the depth you start with is the depth you get. If the new vagina is created to about 6 inches, it will be much more functional for the patient. On the other hand, if the depth is less than 4 inches, it may not work effectively for sexual activities. Second, shrinkage is a challenge. Over time, skin graft used in constructing the new vagina can shrink. The process called skin graft contraction. For example, if the new vagina that starts at 6 inches may shrink to be 5 inches or even less. If we create a new vagina with 6 to 7 inches of depth, even if it shrinks by an inch or so, it will still be functional. However, if it starts at only 4 inches, any shrinkage will result in a depth that is too shallow for sexual intercourse. This is why vaginal dilation, the regular use of a dilatum to maintain depth, is so important. Dilation helps prevent shrinkage and ensures that the new vagina remains functional over time. In this episode, I talk about the vaginal lining and how it's different between a natural vagina and a surgically created one. For a natural vagina, the cells in the vaginal lining are very flexible, allowing it to stretch comfortably during sexual activity. The natural vagina also produces certain fluid that makes it slightly acidic. This acidity helps prevent infection by creating a tough environment for bacteria to survive. For surgically created vagina or new vagina, it doesn't have this natural acidity. That's because the tissues we use to create it, such as skin, colon, or peritoneum, are not the same as natural vaginal tissues. Vaginoplasty is surgery to create a vagina, and there are 3 main techniques: skin graft vaginoplasty, which use skin tissue, colon vaginoplasty, which use a part of large intestine, and peritoneum vaginoplasty or PPV, which use a lining of the abdomen. Why there are so many techniques? In medicine, when different methods exist for the same surgery, it usually means each has its pros and cons. If a technique has no advantages, it wouldn't still be used. Don't forget to subscribe to our channel to learn more in the upcoming episode. See you next time.